do not allow your athlete or your concussed individual to sleep for at least 3 hours after the injury. Hey there, I'm Dr. Mark. I'm a concussion specialist. On this channel, we talk about how to get over your concussion symptoms and how to get back to work, school, sport, or just your regular life. This one's going to be quick. This is a really common question, and that is, how long should you stay awake after a concussion? After a traumatic brain injury, mild traumatic brain injury, after a concussion, how long should you stay awake? Should you be woken up throughout the night? What do you do? We're just going to dive right into it. Right off the bat, the answer is, do not allow your athlete or your concussed individual to sleep for at least 3 hours after the injury. So you're thinking about like a football game or something. If they're injured at 7 p.m., they're not going to bed. You're watching them until at least 10 p.m. After that, it's actually not super necessary to wake them up throughout the night, but it is really prudent for you to check on them. It is really prudent to go in and check and make sure, are you breathing okay? They're not up and agitated. There's no signs of red flag symptoms. And that really is the point of keeping your athlete awake for the first 3 hours, is to look out for red flags right in the beginning. There's no need to go to the emergency room. There's no need for imaging. Those red flags are going to include neck pain or tenderness, seizures, fits, or convulsions, loss of consciousness, double vision, increased confusion or deteriorating conscious state, so becoming less responsive and more drowsy. If there's any weakness, numbness, tingling in more than one arm or leg, if there's repeated vomiting, if there's a severe or increasing headache, if there's increasing restlessness, agitated or combative sort of behavior, or if there's a visible deformity of the skull. These are all red flags that you want to screen for in the first 3 hours. You're really watching for those red flags for the first 24 to 48 hours, but if they're showing up in the first 3 hours, you definitely don't want to let them sleep. You want to get them to the hospital. After that 3 hours, again, it is okay to let them sleep. You do not have to wake them up unless there's a concern. There's labored breathing, there's something about them is just off, and that's something that you'll kind of know. You'll see labored breathing, or again, as the parent, you'll just know something about your child is not right. That's when you want to wake them up and maybe screen for some of these red flags and get them to a hospital. So I don't want to make it all like bleak. So you made it through the first night. Most people are going to, what's next? It's really crucial to be evaluated by a concussion specialist as early after your concussion as you can. We know from more and more data now that how soon you get visited by a concussion specialist is actually a prognostic factor. The people who are evaluated and start rehab sooner recover faster than the people who aren't. So we've got a couple studies where if you're evaluated at like day 4 after the injury versus day 8, so there's only a 4-day difference, that ends up being a 56-day difference in recovery time. We've got another study that shows 14 days. So evaluated in the first 2 weeks, evaluated in 2 to 4 weeks, and evaluated after 4 weeks. And we see that the difference in being evaluated in the first 2 weeks versus after 4 weeks is a 110-day difference in recovery time. That's huge. So the sooner you can get in to see a concussion specialist, the better. So a couple recap points here. Remember, we're not allowing the athlete or concussed individual to sleep for at least 3 hours after the injury. We're looking to be sure they're not declining in this period. Outside of expected fatigue, they're not showing red flags. There's nothing really worrisome. During the night, do monitor and check on the injured individual. You don't need to wake them up, but you do want to check to see if there's deteriorating status, changes in breathing. Again, I keep saying that. That's kind of an emphasized point. Anything different about their status, then you want to wake them up. And following the first night, try to schedule a visit with a concussion specialist within the next 24 to 48 hours. If you can get it in that first 4 days, you're golden. Until next time, I'm Dr. Mark. If you enjoyed this video, you might also enjoy these. Thanks for watching.